Time to look at yet another final exam question. Elbow joint asked for 5 marks. So this is upper limb anatomy. So what are they asking? Elbow joint, 5 marks. So elbow joint is where? In the upper limb, right? And what and all bones are involved here? You have the humerus in the arm, and you have the radius and the ulna in the forearm. And the radius is lateral and the ulna is medial. This is a hinge variety of synovial joint. Okay. So now coming to the details. What are the articular surfaces? Capitulum and trochlea of the humerus, radial head and trochlear notch of the ulna. Okay. So this is what you have to say. Articular surfaces. That is what the textbook says. But just don't forget one more thing. That's one olecranon at the ulna. Olecranon process of the ulna. It goes and sits in the olecranon fossa of the humerus, right? So olecranon process is there. So there are a lot of fossas that you need to know. So if this is the humerus, look at this. This is the humerus, right? Now this is the right side anterior view only. So here you have coronoid fossa, and then you have a radial fossa. So this is capitulum, trochlea. Above that, they are showing some fossas: coronoid fossa, radial fossa. At the back of humerus, what did you see? Olecranon fossa, where the olecranon process of ulna will go. Okay, so these things you need to know. 3 fossas we have told you. Okay, so now let us continue. Now let us look at ligaments of elbow joint. Okay, so ligaments of elbow joint. First of all, you say capsular ligament. Okay, so here they are showing you capsular ligament. So it has a lot of details. You can look at the textbook for that, for capsular ligament. Then you have something called as the ulnar collateral ligament. Ulnar means it will be medial side. So you're looking at the right elbow joint, medial side. You have the ulnar collateral ligament. Then here you have the radial collateral ligament. So you can label the ulnar collateral ligament as medial ligament, and the lateral and the radial collateral ligament as lateral ligament. That capsular ligament, what you saw, that only will have anterior and posterior. Anterior ligament, posterior ligament means they are talking about the capsular ligament itself. Now let's move on to the relation. Okay, relation of what are they talking about? Of the elbow joint. Okay. So what is there anteriorly, guys? Anteriorly, you have to tell cubital fossa contents only, same thing. Okay. So, but you have the brachialis muscle. Okay. Then what and all can you have anteriorly? Anteriorly. So cubital fossa, what and all you have? Median nerve, brachial artery, tendon of biceps brachii. Okay, so these 3 only you have to mention in front of elbow joint. The only thing they didn't tell is the radial nerve I'm feeling. Okay, so in that MBB they have covered. Okay, so that is the anterior content of elbow joint. Very good. Now let's see what is behind the elbow joint. You have the tricep brachii. Can you say behind the elbow joint there is tricep brachii muscle. Medially you have ulnar nerve, flexor carpi ulnaris and common flexors. Okay, flexor something. And laterally what do you have? Supinator, extensor. Okay, you can remember extensor carpi radialis brevis and extensor. So flexors in the medial side and extensors in the lateral side. Okay, this is what you can remember as relation of elbow joint. So what and all you have? Medially flexors, laterally extensors. That much I understood. Ulnar nerve, they are telling medially. Laterally, they are talking about supinator, extensor carpi radialis brevis and common extensors. Okay. So now we are done with this. Now let's go to the next topic for elbow joint, that is blood supply. Blood supply is, there's a lot of blood supply around the elbow joint. Lot of anastomosis are there. You have to remember this. Anastomosis. Okay. Okay, so let's look at the anastomosis and all that. So what nerves are what arteries are supplying? Axillary artery mainly, that is getting divided into brachial artery. And then what other artery names do you see here? Radial artery, ulnar artery. So I'm seeing ulnar artery in the medial side, radial artery there. Okay, from where are they coming? They're all coming from brachial artery if I'm not wrong. some recurrent artery, like that you can say. Okay, guys. Now let's go to nerve supply, guys. So nerve supply. So let me draw the nerves here. So what do you have here? Ulnar nerve, median nerve, radial nerve. So what do you have here? Ulnar nerve. The middle, whatever is going is median nerve, and then you have the radial nerve. Okay. And then you have one musculocutaneous nerve through its branch to the brachialis. Some musculocutaneous nerve is also there. Okay. From where is all these nerve coming? From your brachial plexus, obviously. Okay. So you're done with a lot of things, but still the movements of elbow joint we have not done. So very quickly we will tell the movements of elbow joint. Flex, extend, flex, extend. Who are the muscles who will do all this? That is also super easy. Okay. So flexion, biceps brachii in front. Okay. Biceps brachii. Extension, triceps brachii. So easy. Biceps and triceps. So strong. Okay. When you say bicep brachii, no, biceps will take all the credit. So you have to also say some other muscles like brachialis and brachioradialis. Okay. All these are what? For what? Flexion. Biceps brachii, brachialis, brachioradialis. Okay. But triceps guy seems to be alone. He has some anconeus with him, which is nothing but triceps only, if I'm not wrong. Okay. There's one more thing that you can write about elbow joint. Clinical anatomy, you can make it and put it. The carrying angle is like some 13 degrees. Okay. That's what you can remember. So, carrying angle is 13 degree. Carrying angle, 13 degree. Okay. What is 13 degree? See, if you draw a straight line, this forearm angle is actually 13 degree. Okay. Extended forearm is not in a straight line with the arm. So if you extend your forearm, it is not in a straight line with your arm. Yeah, I'm seeing it. It's actually gone off somewhere. 13 degree away. Okay, I can understand this. This is carrying angle. Okay. At 5 marks, this much information is enough. If they ask you only carrying angle, then you can write. Okay. For now, let's wrap up here. Clinical anatomy, you can mention tennis elbow, etc. Just that tennis elbow, minor's elbow, student's elbow, because they're always keeping on the elbow on the table and writing. So student's elbow, golfer's elbow, what and all elbows are there. Okay. Say clinical anatomy, you can say tennis elbow, minor's elbow or student's elbow. Then you have golfer's elbow. Too many elbows are there. Okay.